Hey everyone, this is Clifford Blood and I did my presentation on gonorrhea. So an outline for what this presentation will go through: the disease cause, patient presentation and symptoms, how the disease is transmitted, the reservoirs, treatment, and genetic makeup. Gonorrhea is a sexually transmitted infection caused by infection with the bacteria known as Neisseria gonorrhoeae. Mucous membranes of the reproductive tract are infected, including the cervix, uterus, fallopian tubes of women, urethra in both men and women, and the mucous membranes of the mouth, throat, eyes, and rectum in both men and women. The CDC estimates that 820,000 new infections occur in the United States each year. So the disease is caused by Neisseria gonorrhoeae, aka the Gonococcus, which is the bacteria that causes gonorrhea. On the right there is a picture of gonorrhea under a microscope slide provided by NPR. So presentation and symptoms: men are asymptomatic. They can have dysuria or white, yellow, or green urethral discharge that usually appears 1 to 14 days after infection. This can be complicated by epididymitis, which is inflammation of the epididymis, which stores sperm, and this is where sperm can mature. So if epididymitis is left untreated, it can lead to infertility. Men with gonorrhea may also complain of testicular or scrotal pain. Women can also be asymptomatic. When experiencing symptoms, they can be nonspecific and are often mistaken for a bladder or vaginal infection. Initial symptoms and signs in women include dysuria, increased vaginal discharge, or vaginal bleeding between periods. Women with gonorrhea are at risk of developing serious complications from the infection, regardless of the presence or severity of symptoms. So the takeaway from this slide is that if someone is sexually active, they should absolutely get checked regularly, because gonorrhea can be asymptomatic, and so someone could be sexually active and not know that they have gonorrhea. Rectal infection can also be asymptomatic, but if there were symptoms, they would include discharge, anal itching, soreness, bleeding, painful bowel movements. Pharyngeal or throat infection is usually asymptomatic, but if there are symptoms, that would include sore throat. Pregnant women can give the infection to the baby as the baby passes through the birth canal during delivery. This can cause the baby to have blindness, joint infection, or a life-threatening blood infection. It's very important that if someone is pregnant and they have gonorrhea, to get treated for gonorrhea, because the baby will not get gonorrhea until it passes through the vagina. So as long as it's before birth that gonorrhea is treated, the baby should come out okay. So transmission: gonorrhea is transmitted through sexual contact with the penis, vagina, mouth, or anus of an infected partner. Ejaculation does not have to occur for gonorrhea to be transmitted. Also can be spread perinatally from mother to baby during childbirth, like the previous slide showed. People who have had gonorrhea and received treatment may be infected again if they have sexual contact with a person infected with gonorrhea. So if someone is infected, they can always get it again if they're having sexual contact with someone that is infected with gonorrhea. So just because you were treated once, it doesn't mean you're good to go. You can get infected multiple times. So the reservoirs: animals, insects, they do not have to deal with gonorrhea. It is specifically for humans. They're the only reservoirs for gonorrhea. Spread person to person through direct contact. Both men and women are reservoirs. Again, the sites of infection include the anus, mouth, throat, and reproductive tracts. So treatment: Neisseria gonorrhea is developing resistance to the current drugs being used. The current drug being used is known as ciprofloxacin. Resistance to this drug has now spread across the globe. The World Health Organization has created new guidelines, and they're saying that if you combine gentamicin and spectinomycin, you should be okay, but current research has been showing that there's a resistance developing against these two drugs very quickly, and because there hasn't been much research for these two new drugs, the treatments haven't really been effective for gonorrhea. World Health Organization is looking at initiatives to develop new drugs for gonorrhea. So the genetic makeup of gonorrhea is a single-stranded DNA genome. On the left is a illustration of gonorrhea from Medical News Today. On the right is, again, that NPR slide from a perspective through a microscope. And that is it. Thank you for listening.